And more on issues faced by caregivers. 9 in 10 older adults with advanced dementia living at home in Singapore experience what researchers are calling burdensome medical interventions. A new study by Duke-NUS found that such procedures, like the use of feeding tubes and restraints, are common, even though they do not improve patient comfort or caregiver burden. Now, these interventions come despite almost all caregivers agreeing that comfort was a primary care goal. The study also found that the majority of caregivers reported receiving inadequate information when making care or treatment decisions. Less than 1 in 5 caregivers are told how much longer their loved ones might live as well. Now, the researchers from the Lien Foundation for Palliative Care at Duke-NUS join us now for more analysis. We have Senior Research Fellow Dr. Ellie Bostwick Andres and Research Director Associate Professor Chetna Malhotra. Ellie, Chetna, welcome to the studio.
Thank you.
Thank you. Now, Ellie, we want to start with you. We know the number here is 90% of older adults with advanced dementia living at home. They underwent at least one burdensome medical intervention in their final year. Can you tell us about what this says about the state of at-home care for advanced dementia patients?
Yeah, so this isn't so different from everywhere in the world, but it does tell us something about Singapore in particular in terms of we are caring for our loved ones with dementia at home here, whereas in most of the world it's in long-term care settings. So it's a different setting. So what this research is telling us is that we need to do a better job supporting these caregivers because these are things that are happening at home, and they're doing a tremendous service for their loved ones and then also for the community at large. And so we need to do a better job supporting them so that they aren't making these decisions.
Yeah, where specifically would you say we're falling short here? Maybe, Chetna, you can tell us.
I think maybe not enough conversations are happening between caregivers and healthcare providers. And it's important to have these conversations so that the healthcare providers can understand what is it that matters most to caregivers. What are their beliefs? What are their value systems? So that they can provide care based on what is important for the family.
Yeah, and speaking of what's important, patient comfort has come up very important. In fact, 98% of caregivers agree that that is a primary care goal. So why are procedures like feeding tubes or even restraints still being used when clearly it does not bring patient comfort? Ellie, can you tell us?
Yeah, I think it goes back to what Chetna's saying about the conversation. So there's a few things. I mean, comfort care, it can mean different things to different people, and we don't always agree necessarily on what that means. But at the same time, these are really emotionally charged situations that they're having to make decisions in. And so you often resort to your emotions. You don't necessarily go to the comfort values that you would have, especially if you haven't had these conversations before to plan what you would want to do in this situation. So
is it also a lack of available options for the caregivers? Maybe it's something they feel tools they have to use because they don't have other options?
I think that happens when they haven't been able to think long-term about what the dementia trajectory is. So then they make the practical or the feasible decision for that moment without thinking what this looks like, down the road.
Yeah, when we think about long-term, we also think about the longevity of patients. That's definitely very key on both sides, right? So how do we then reconcile what the caregiver needs, what they hope for the patients in their recovery, and also the patient's dignity and quality of life?
Yeah. And that's an important reality for caregivers, that caregivers may have multiple priorities at the same time. They don't want to see their loved ones suffer. And at the same time, they hope for more time with their loved one. So, and when this happens, we encourage caregivers to think about what is it that their loved one would have wanted at that point in time. And then go back to their provider and have this conversation about how much more they are willing to do, how much far they are willing to go until the treatments appear burdensome or inappropriate to them.
Yeah, I want to pick up on those conversations as well, Ellie. So a lot of times we're talking about dementia patients. They don't really have the full capacity, perhaps not just to be attuned to what they need, but also to convey that clearly to caregivers. How would you then overcome this challenge when you say that conversations are important, but yet the patients are not necessarily equipped to have those conversations?
I think any preliminary conversation before you're in this kind of acute situation is always helpful. So great if they can talk to their loved one before they're not able to communicate their preferences, But next, if they can talk to their provider about what their shared values are, what they think the patient would want, anything that they can do beforehand so that they have a little bit of a plan, so that it's not just catching them off guard is best.
Now, I want to pick up on another figure here. Only 15% of caregivers are told how long their loved ones might live. That is a big gap. Why is the information gap there, and what can be done to narrow it?
Yeah, so it's a big gap. I think that it's a lot of things. It's a difficult conversation to have. It's hard to know how long it's going to be. It can vary a lot from one person to another, but it's so important that they have a bit of a roadmap so that we can tell what phase of dementia they're in, what's coming, so that they can make decisions, they can make arrangements, they can prepare emotionally, and they can prepare practically for what it's going to be like.
Yeah, Chetna, what does this information gap mean in terms of impact for both the caregivers and the patients? I imagine it must be quite painful or difficult to not be able to anticipate how long my loved one has left to live.
Yes, and absolutely. And when we think about Singapore, and as Ellie said, that most of dementia care happens at home. And so the caregivers are actually the most important stakeholders here that we need to care about. They are the most important palliative care providers. And so if we think about that perspective, we need to support our caregivers a lot more. And it's not just about providing emotional reassurance to caregivers, which of course they need, but also they need a lot of practical skills to be able to take care of their loved one at home. So for instance, they may face many situations, like for instance, their loved one may have verbal or physical agitation. What to do at that point in time? When they're refusing to eat, how should I respond? What are my options? Should I necessarily resort to tube feeding? Are there other care options available to me? So these are some of the most practical questions that come up along the caregiver's way. And we need to support them to provide that home caregiving.
Right, so greater awareness on the part of the caregivers, but also, Ellie, the idea of supporting caregivers in terms of their mental health as well. It is a long journey much of the time, and it can be very exhausting for caregivers. So what kind of support is available or should be made more available to caregivers?
Well, that's something we're working on, and Chetna can talk about it a bit more, but trying to develop these kind of supports, so emotional support that they can get from peers and from others that are going through the same thing, but also just very practical supports, how to navigate each thing from feeding to anything else. But,
yeah, and our team is trying to use technology to reach out to caregivers. So we have designed a mobile app called Care Buddy, which we think about it as a one-stop solution that has everything, all the information that a caregiver may need to support their loved one at home. It also connects caregivers with healthcare providers and with other caregivers who might be experiencing a similar journey. So we estimate that there are about 70,000 caregivers or more who are in this situation within Singapore. And our vision is to reach out to all of these caregivers and support them at every step of the way.
Chetna, Ellie, thank you so much for sharing about this initiative with us. I've been chatting with Senior Research Fellow Dr. Ellie Bostwick Andres and Research Director Associate Professor Chetna Malhotra from the Lien Centre for Palliative Care at Duke-NUS.